Lung cancer. It's by far the leading cause of cancer death among all Americans. It knows no bounds and strikes non-smokers, smokers, men, women, and races and all ages. In recognition of National Lung Cancer Awareness Month, I'm joined by oncologist Dr. Gilberto Lopes and lung cancer survivor Millie Torchia. Good morning.
Good morning, Kelly.
Good morning, everyone.
Doctor, we'll start with you. How deadly is lung cancer?
Unfortunately, most patients who get diagnosed with lung cancer today get diagnosed at stage 4, and this is disease that has spread to different organs and has come out of the lung. And for these patients, we do not have the hope of a cure for most of them. We do have new treatments that do bring the hope that we can help them live longer and hopefully maybe make lung cancer a chronic disease. But the earlier we can detect the disease, the better, because that gives us a chance for cure.
And how about the Hispanic population? Is it more common?
It is not more common, but it's still very deadly. So lung cancer today is the #1 cause of cancer death for Hispanic men and #2 cause of death for Hispanic women. So extremely important.
And would you say, is there hope for people who have been diagnosed with lung cancer?
Absolutely, and this is what we have been seeing the last couple of years. We have a number of breakthroughs, including targeted therapies and immunotherapies, and we hope to be able to speak about them a little bit today.
And who should get screened for lung cancer, and how important is that early diagnosis?
It's extremely important that whoever smokes stop smoking, and that those of us who don't do not start. And for those that do smoke, it's even more important that you go see your doctor and you talk about getting a CT screening. And that is for patients who are older than 55, have smoked more than a pack a day for longer than 10 years. And what this does is that this is a lower dose CT scan, which is a diagnostic test, and it can help us detect the disease at stages 1 and 2. And most of the cases that we do find when we do this screening are very early and have an 80% or greater chance of cure.
And Millie, we understand that you were just diagnosed with lung cancer in June. What did you think when you heard of the diagnosis?
Yes, June 22nd was a day that I will never forget, Kelly. It was the afternoon, and the doctor called me to give me the results of my bronchoscopy, and he told me I had cancer. I went from thinking that I had pneumonia to cancer. My world came to an end at that moment. I couldn't believe it. I thought that he had made a mistake, but they told me that they had tested 4 times. After the news settled, of course, I thought of my daughters. I have 3 young babies that are 9, 7, and 3. And I thought, who will see them? Who will help them every day with their homework? Who will help them just for their everyday things? And I was afraid that I would not see them grow up. I didn't know the reality that it was later on that I found out that I actually had stage 4 and the cancer had already spread to my lymph nodes, my bones, and my brain.
And you are not a smoker, are you?
Yes, I have never smoked or been around people that smoked. I do know that now that if you have lungs, you can get lung cancer, just like me.
Well, we're happy that you've gotten through this journey. You're obviously very strong.
Yes, I pray every day. I thank God for every day that He gives me, and I pray that these medications continue to work. I am taking one of the targeted medications, and it is because of that medication I'm here. It has given me hope to keep on going.
Well, we want our viewers to stay informed. Where can we go for more information on what we discussed today?
Sure. They can go to the Lung Cancer Foundation of America webpage, which is lungcanceramerica.org. It is very important. There they can find out information about lung cancer, read other stories just like mine, and help raise this awareness that we need. It is a horrible stigma to think that only people who smoke have it, because there are many other people just like me who have this disease. Many other mothers, I have met people that are younger than me and have this. And I know now that this is disease that you get it, you know, if you have lungs, you can get it.
Right.
Everyone can get it.
Right. Well, thank you so much for your time this morning, Dr. and Millie.
Thank you, Kelly.
Thank you, Kelly.
The Morning Blend continues.